Alrighty, it looks like we are all set to go. So, hello and welcome everyone to another Fireside Chat with me, Katrina, where we talk about conversations surrounding healthcare, business, life, and everything in between. Today, we will be having a chat surrounding patient experience, a topic close to my heart, with someone I truly admire, Jyoti. And for anyone who doesn't know Jyoti, she has experience as a leader and in healthcare, focusing on operational innovation and patient experience, with certificates in leadership and coaching to instill change in the industry. Her experience ranges from work as a biomedical engineering technologist to operations strategy. So, Jyoti, thank you so much for being here to talk with me today to talk about patient experience as we kick off Patient Experience Week 2024. Woo! Welcome,
Thank
Jyoti.
you. Thank you. Thanks, Katrina, for having me.
Very happy to have you here. To start, could you just give us, I know I gave a very brief overview of your professional career, but could you walk us through your background, education, anything that contributed to getting you here to Health Hub today?
Yeah, absolutely. So I did, as you mentioned, started out in biomedical engineering. And then from there, I was very interested in patient safety and quality improvement in the healthcare settings. So I am certified also as a Canadian patient safety officer. And then I managed quality as well as clinical services and non-clinical services. And in the hospital setting, very recently, I managed patient experience at a large multi-sited organization. And now I'm with Health Hub as the senior manager for operations strategy.
We love having you here.
Thank you.
So I know that you had mentioned that you had worked as a manager for patient experience. We're having this chat for patient experience week, but could you define what patient experience is to you, and what does it kind of look like?
Patient experience to me, I think anyone that's worked in a hospital setting and anyone that has interacted with the healthcare system, it's definitely the clinical care and the quality of care is a huge part of it. But on top of that, it's about every single interaction that a patient has with the system. So it could, it's the physicians and the nursing teams, allied health, but also equally as important are the food services teams and other folks that interact with the patient. Um, and really, it's about how easy we make that journey for the patient. So it's, no one wants to be in a hospital, other than potentially those that are going in to have their children. So how high quality that service is that we're providing to them, and how easy that navigating of that system is for the patient.
So it would be like the entire process in terms of the second that someone knows
Mm.
that they have to come to the hospital, right to the very time they are discharged, or does it go beyond that even?
It does go beyond. So it's, from, as you said, from the part of that registration coming in, seeing typically a lot of the entry to the hospital happens through the emerge department. But, once you receive your care and as at the point of discharge, knowing what's coming next, if they have any follow-up, care that's required, if anything comes up, that information that they may need at the time of discharge to ensure that, how to take care of, if it's something that's long-term, how to take care of that, or to prevent that from happening again, or any follow-up that they may need in the community.
Yeah, absolutely. So it's a huge, broad range
Mhm.
of um, touch points, I would say, where every little bit contributes to the patient experience. So, like you said, just even like the food services, that all contributes to that. Um, I guess switching to like a more personal side, are there any memorable moments that you have? It can either be through your work experience seeing other people, or a personal experience that was either positive or negative that really just affected someone's level of care.
Yeah, so many to count. And I think, being very fortunate enough to work in the setting myself and seeing day in, day out, everyone that interacts with the patients doing their best to support patients as well as their families and loved ones who are, equally a part of that journey. On a personal side, I did lose my father about almost 2 years ago. And as difficult as that moment was, I think, and this is out in BC, the nursing team, the physician team, and everyone else that interacted with us over those last 3 days, the difference that they made. So whenever we talk about that difficult and sad moment for us, we also talk about how much support we had. Every single person cared about him. We could see that, but they were also very compassionate towards us as well, knowing that we were going through a difficult time. And I I mean, I could probably name the testing that was happening. The rest of my family probably cannot mention clinically what was happening, but they could tell you exactly which nurse came in and checked on them and, just offered that support. So I think that to me, that was the sort of the highlight of how wonderful the environment can be made, even though when you're going through a difficult situation.
Absolutely. And it's amazing that those nurses and the healthcare staff were able to provide that experience for you. I know even on like my personal end and any interaction with the healthcare system that it's like, you know, I might not remember exactly what was happening, what diagnosis came down, but I remember some of the nurses coming in and having a really good laugh with them.
Yeah,
And that really I think makes a difference because, like you said, not everyone is going to understand medically what is happening.
yeah,
Um, and what comes to mind right now is the phrase, people don't remember what you said, they remember how they felt
yeah.
leaving a conversation.
Yeah, yeah, absolutely. And I think even for us to go, for myself particularly, to be able to go look at that situation and feel so grateful for, in that moment,
Mhm.
us as family and my father as the patient, like we were so well supported that yes, the outcome wasn't what we wanted, but what they did, we're so, so grateful for. So I think I take that in my work everywhere I go.
Amazing. So then using either that experience or just any combination of experiences, what does excellent patient experience look like?
So it's multifaceted.
Not very
Definitely
direct.
quality, as we were mentioning, is important, safety. But I think one of the things that makes it excellent is that communication part. So collaborating with each other when it comes to the clinical team, as well as collaborating with the patient as well as the family, ensuring that it's it's not, we're not doing things to the patient, we're actually involving them in the care. And at times, the patient may not be able to speak or participate themselves, but they have loved ones there around that are supporting. And also taking into consideration that, the platinum rule, as we call it, like not treating people as we want to be treated, but instead how they want to be treated, including them in that journey to see what their preferences are. And, relating to our work now, being able to, even when a family or a patient's loved ones can't be at the bedside, like through our integrated bed terminals, they're able to still participate through video chatting on the systems that we have in the patient's rooms.
Yeah, absolutely. And I think that you bring a really important aspect to the conversation where it's labeled as patient experience, but also at the same time, you've got every family member who walks in that door, you've got their friends, and they will talk about their care and what was going on during their time in the healthcare system to other people as well. So it really branches beyond just the one individual patient. And I think it's a huge part of it is just meeting them where they're at and listening as well.
Yeah, and I think the only other thing I'd add is when we look at patient experience, it's also about the provider experience as well. So having managed clinical teams and worked very closely with physicians and nursing and allied health and other, there's so many different roles. Um, it's also about how easy we make it for them to be able to create that experience. So as leaders in the healthcare system, and even as leader now in at Health Hub, how are we making things easier for our providers to create that experience, because they are, as we know, they have a lot on their plates. There are more patients than they're often able to work through, but they are able, if we are giving them the tools, the resources, and that ease of access, then they're able to focus on compassion and empathy a bit more. So I think enabling them. So if we support it's I'm thinking about another quote. It's by Richard Branson, but it's about supporting our providers to be able to then provide the high level quality of care to the patients ultimately in the end.
Gotcha. And so when you say provider, you're talking about the hospital
The
and like
hospital side.
everyone that's within it. Gotcha.
Yeah,
Okay, just wanted to clarify that. I think that's kind of given me a perfect segue into when you're in these business meetings, when you're speaking with providers and you're interacting even with our team, how much of a role does considering the patient experience go into that decision making? Like, is it at the forefront of what you're thinking about? How does that work?
absolutely. It is the center of every conversation that we have internally and then with the clients. So the ultimate goal is obviously to ensure that that patient care journey is smooth, it high quality experience that the patients are having. But when we look at making decisions on what do we prioritize, so in the healthcare system, when we're making financial decisions or when we're considering what to prioritize over something else, looking at what will ultimately have the best impact or the most positive impact on the patients. And it may be the clinical service providers as well as the patients together. That's always looked at. So for us internally at Health Hub, when we're trying to prioritize, let's say it's a new system that we're bringing in for rental management system that we're working on now. A key component of that is to make sure that it's easy to use for our patients. It's easy to use for their loved ones as they're having those conversations. So that's always top of mind.
I agree with you. I think, and this is by no means just like a drag on anyone else, but I think that's where a lot of companies struggle sometimes, or they aren't able to achieve their full excellence because they've got a team of amazing, like smart people who and have really amazing ideas, but then also focusing on the demographic and the audience that they are providing those services for, right? And you mentioned and just like throughout this conversation so far, when you're meeting these people in the hospital, it's probably the worst day of their life or
Mm,
one of like they don't want to be there. And also they're sick, they might be bedridden, like, and it might also, well, it's more than likely going to be like an older demographic too. So I think having that advocacy and paying attention to that is huge in terms of even like operations.
yeah, and absolutely. And I think the other thing that I'm very proud of when it comes to Health Hub is we have you know nurses who are on our team.
Mhm.
We have execs from previous hospital experiences who are on our team that can help inform how we do things. So we have, as you know, our clinical advisory panel that does sessions for our internal team. So we have brilliant people who are on product and marketing sides, but if they're missing that one component of that clinical side of the things, they may overlook something. So, but we pair that up really well with our clinicians that are part of our teams, and along with that, when we're having the conversations with the patients, with the hospitals, especially the decision makers on the hospital side, often our team has partnering with the hospitals, worked through the patient and family advisory councils as well. So presenting a new solution to them, getting their feedback, and making sure that's incorporated into what we built together.
Amazing. I love that. Is there a way that you're able to track with our services, um, the impacts, I mean, hopefully positively, that our IBTs, our bedside terminals, are providing? Like, is there a continuous loop of feedback? And how is that, I guess, um, quantified? How's that measured?
Yeah, so we have multiple ways, and as much as every organization wants only to have the most positive interactions, the negative interactions are equally as important, because then we can, not having the negative interaction, but the feedback
Yeah,
from the negative interactions is very important, because that helps inform how we do things better going forward. So with sort of my own focus on quality improvement, we receive positive and negative feedback through multiple channels. So we have our Google reviews. We also have customer satisfaction surveys that we send out to patients. We also have our patient experience ambassadors, and customer success ambassadors that are on site at all of the different hospitals, or multiple different hospitals, that are able to get that just in time feedback from the patients and families. So all of that is looked at, and then when you're working through a specific project with, let's say, a hospital or a hospital system, we have further engagements that allow us to capture that feedback and build on that.
Awesome. Definitely. I think uh, and I feel like I'm just bringing up quotes, but the idea of if everything is going perfectly, you're doing something wrong.
Mm-hmm.
I feel like that is so important in terms of getting that feedback because you're right. All you can do is get better because of that. If you're actually like truly listening, then it just ultimately makes the product and service better.
Yeah, yeah, absolutely. And we also have, training that's informed by that feedback. And that's not just training for internally for Health Hub, but our partners that we work with as well. That once we receive feedback, and if, well, especially because we look at trends and we look at the feedback that we're receiving, so we utilize that to improve our training as well.
Amazing. So you've mentioned that we have clinicians on our team, nurses, like all aspects of healthcare informing decision making within Health Hub. I would like to flip that on you and just recalling your time as a biomedical engineering technologist. How does that experience give you a unique perspective in Health Hub and on healthcare?
Um, a good question. I haven't thought about that in a long time. It seems like a former life, but very, very a part of my life that I'm very proud of. I think I was very fortunate. So I went to school out in BC, but I did my very first role was at Sick Kids downtown here
Mhm.
in Toronto. And being a teaching hospital and having that focus on, every interaction, like going back to that, like we're all the patient experience. So every interaction matters. So if you've been ever at Sick Kids, you'll see that like as you're interacting with different people, as families and patients are walking around, um, we all make that effort into making that time easier for them. When it comes to the actual work part in biomedical engineering, the main focus is to make sure that there's the right equipment available to the patient at the right time, and it's functioning according to its specifications. It seems so long ago, but so that's the gist of it. That's to put it the most easily. So looking back, I think thinking about the fact that this is, someone's child that's going to be using this pacemaker or this defibrillator, potentially. So, putting your all into it to ensure that it's working to the, to its full specs, making sure that everything is checked on time, making sure that as we're working with vendors to purchase new equipment, it meets all of the guidelines that are required to be met. It's also meeting not only sort of the clinical needs that were initially specced out, but also when it comes to, there's a section of biomedical engineering that's called human factors. So ensuring that when a clinician is interacting with that device, how likely it is that they can make an error. So checking that we're enabling the patient, that we're providing the systems that make that likelihood of creating an error through usage of it very low. So it's there's so many multiple
Yeah.
different areas of it, but I think it's sort of the quality part of it that was more in focus there.
Yeah, absolutely. And it's interesting because you brought up points that I wasn't necessarily aware of about what goes into biomedical engineering. Because my follow-up question was going to be, well, would you say that that part, like that title, was involved in patient experience? And it sounds like it definitely is, and it introduces another level of just putting like attention and care into what you're doing and how that ultimately will affect someone down the line.
Yeah, yeah, absolutely.
Perfect. So then I know we've kind of touched on this throughout our chat. Do you think, and I feel like I know where this is going to go, but do you think that actually being attentive to someone affects their healing journey and like having a positive patient experience actually impacts their like biological well-being?
I do believe in that. I think every interaction, within, definitely within the healthcare system, but even outside of it, when we're having a positive interaction, it impacts how the rest of our day goes. So definitely in healthcare, and I think in the context of, a patient, and that the support that they may have received, or that compassionate conversation that they may have had with anybody in the clinical team, really does help, because and I could use an example of what we have through, like voice and language line, like our interpretation services that are available. Imagine someone who isn't able to speak, like English is not their first language, and having a conversation where, they've understood parts of it. Maybe they have a family member that's there to support them, family member available even through video chat, but having access to voice or language line right at the bedside, where they can have an interpreter, make sure that they're, every single thing that the physician or the nurse is explaining, they're able to participate. So it's not about absorbing, but it's also being able to participate in that conversation. um, that's night and day, versus just, like you having to listen, or getting a document that you have to now take home and read with someone else that can explain it to you. But we are flipping it from there to be them being able to participate and have that conversation, being able to ask the right questions. It can have a world of difference in their journey.
I think what the example that you're bringing up with voice is so important because I, um, one of my friends in elementary school, both of her parents were hearing impaired. So she communicated with them through sign language, and she always had to come along to doctor's appointments and had to be the interpreter. But she wasn't like interpreting things that she didn't even fully understand. She was getting that
Yeah.
news before her parents were, if anything like that came along. And I think when you're receiving that news and having to be that translator, it also adds so much stress because the family member can't be present in that situation.
Yeah.
And I think that brings like an important conversation about just the role of stress. And I think that by alleviating that one stress, it's like, okay, by being present in that conversation, you're actually allowing them the opportunity to process the information and in a way that's accessible to the patient and the family member.
Yeah, and absolutely right. Like I think it's being able to be present, and also one of the things that I remember when I managed a clinical team, um, for the clinician, let's say if they're having the conversation and they've just, they're new on shift, they've just realized that this person doesn't speak English as their first language, having that access right there, versus them having to then go find an iPad or go find something else that they can,
Yeah.
use to interpret. So there's that part of it. And another part of it too is, equity. Like we sometimes, often, people of our generations, they take it for granted that everyone
Yeah.
has a device that they can use, pull out and use, maybe Google Translator. But not everyone has that, especially, the elderly population that's in the hospitals. They may or may not have a device. Even if they have it, are they actually able to access it quickly enough to be able to utilize that service? So it supports both the patients as well as the clinicians as well, to be able to get that equal access across the board, regardless of what you come in with.
Absolutely. And just really saying we're taking care of you. We see you
Mhm.
and we're meeting, like we want to provide you that excellent experience. And I think too, a part of it that you've mentioned as well is time. I think
Mhm.
that there's a lot of instances where maybe stereotypically physicians have come in or interpreted that I don't have enough time to connect with those people. But I think that when you eliminate those barriers, you're like, okay, just being able to show up attentively to that conversation really does impact that person's journey within the healthcare system.
Yeah, yeah. And, as you mentioned, stereotypical, right? Um, Having worked in the healthcare settings, and having worked, collaborated very closely with the physicians, as well as nurses, allied health, and everyone, um, time truly is a factor that impacts their ability to be as present, be as compassionate, and take as much time. So, providers like Health Hub, and other providers that support, what we could do is reduce the likelihood of that becoming a factor. So instead of
Mhm.
them having to, access somebody that's, because, 5, 6 years ago, it was an interpreter. You'd have to call over the phone, wait, hang, schedule in
Yeah.
advance, all of those things. And it adds so much more on to not only the physician's part, but also, the ward clerk, because they have to
Yeah.
organize that for them. And then the family, if they need to be present. So in this case, having all of that available right at the bedside allows us to support that. Health human resources is a challenge. And I think in the coming years, that is going to stay a major challenge that all hospitals throughout the world,
Yeah.
not just Canada, we're trying to address. So what can we do? What role can we play to make sure that we're addressing that? And technology, as we're saying, like that digital transformation is happening throughout. So how can we be a part of it and support our patients, families, and also clinicians and all allied health to be able to provide that better experience?
Absolutely. I always tell the nurses, ward clerks, everyone I'm interacting with at the hospital, I say, I'm here to help you too. Like,
Yeah.
I'm here to alleviate your stress because if you don't have to run around the floor looking up and down for an iPad, wow, it really does make a difference. Like,
Yeah.
just to be able to say it's available right here whenever you need it immediately is
Yeah.
just such a huge difference.
Yeah. Yeah. Absolutely.
Perfect. And then, so as we're talking about empowering others, helping others, having compassion and listening, I do kind of want to shift briefly to a corporate setting. And so, because I've worked with you and through knowing you, I know that you put a large emphasis on empowering the team that you work with and wanting to be a good leader for your team. And I think that really does factor into patient experience by saying, oh, we want to create these, but how do you enable your team to be able to create this positive experience? So I was curious, what does being a good leader look like to you, and how would you empower your team?
Wow, that's a loaded question.
I
I'll do
know.
my best to answer. I think for me, like I see leadership as actually a service. Like I am here to serve you to be able to do your to do your role better. And as you mentioned, and I'm glad that you're noticing that, like it is a big focus of mine to make sure that my team has the tools, has the resources, has the training, has the support, and has the advocacy as well to be able to do what it is that they need to do. So I think a huge part of that is being able to listen. If I'm not hearing, if I'm only, as we mentioned before, if I'm only hearing positive feedback, that means we're not challenging ourselves. We're not growing as a team. So being able to listen, all negative feedback is, or all feedback, first of all, is a gift. And I think when somebody takes the time to bring up, especially to a leader, any negative feedback, it shows you that they are engaged. They want to be a part of, sort of the overall growth and expansion of whatever we do as a team. Um, and I think like listening to me and the other part of, as you mentioned before, my passion is coaching. So being able to listen, being able to work with people's strengths. It's not just about, looking at what they're not able to do, but also look at like what it is that they're good at, and like having those deeper conversations to be able to support and encourage them to go and explore that and grow through that.
I love that. I think so many principles of that can be taken in so many directions. Like we're talking about healthcare and just um, burnout being a huge, um, I guess, problem.
Yeah.
Being so prevalent, I think, is the better way of putting it. But being so prevalent, I think that having leaders there to say, okay, I see you, I'm listening, is so important.
Yeah.
And thank you for having that mentality and bringing it to our teams because it really does make a difference.
Thank you. I think we are very lucky to be in an environment and in an organization that's very flat in the sense that you could have a conversation with anybody
Hmm.
throughout. That makes it easier. So both for feedback as well as for growth. I think if you're able to, have a conversation with someone that you look up to, if you're looking for mentoring, coaching, and getting that support, that allows you to do that. And then what we were saying sort of in the middle of this conversation, if we support you in being able to do your role better, if we support you with the tools, resources, and training that you may need, then you're ultimately passing that on to the clinical teams that you interact with in a hospital,
Mm.
and then the patients that you interact with the hospital. And that is, it's that circle of giving. We're all paying it forward in one way or another.
I I love that. You brought it sparked there's a chap, I think Simon Sinek,
Yeah,
is the idea of having those like exponential growth on leaders, and that
yeah,
every person that you interact with, you're then instilling that thought process and challenging maybe what it looks like to be a leader, and then it can expands and grows and grows. And I think that's only a positive thing.
yeah, absolutely. I'm a big fan of his as well.
I, I know. I'm like, I've watched a few too many of his stars.
Yeah.
Um, Perfect. Well, thank you so much for sharing your thoughts and everything. I just have one final question for you, and it is, what advice do you have for someone who's starting in the healthcare system, and what do you think they should know about patient experience and how it goes into their job?
Um, when it comes to knowing about patient experience, I'm still learning every single day.
Yeah.
So I think that just coming with that open mindset about, being open to learning, being open to having conversations where you're not having a conversation just to prove your point or to give a
Mm,
response, but you're really listening to the other person. And being able to explore. So my journey, as you mentioned, from biomedical to then in patient safety and
mm-hmm,
quality, and then like clinical management, patient experience, and now here, all of it started from conversations, being genuinely interested in what others do and how I can help. Um, People, and I think you subscribe to that thinking as well. You don't need a title to be able to make a difference. So
mm-hmm,
being able to really have those conversations, and then when it comes to creating a positive patient experience, as simple as acknowledging the presence of somebody when, as we're going into a room, introducing yourself. These are basics, which I think our team does very well with, but
mm-hmm.
I can tell you that when that doesn't happen, it impacts the experience so negatively. So compare a person coming in, they do everything perfectly when it comes to the clinical care, or let's say it's a technical repair that they're doing. They've done everything perfectly and walked out, but there was no introduction, there's no
Mm-hmm.
acknowledgement of the patient or the family member that was in there. And if those two things didn't happen, that becomes a negative conversation. Versus if someone came in, introduced themselves, acknowledged the person, showed, expressed some level of compassion, even if they couldn't fix what was going on with
Mm-hmm.
that, the device or, the clinical interaction, that will be seen as a positive experience. So it's about the how, not the
Yeah.
what. Um, so just focusing on that.
How, not the what. I think that's huge. I love it, and I really, really appreciate you taking the time out of your busy schedule to have this conversation with me about patient experience and bringing your knowledge, your experience, everything to the table as we kick off Patient Experience Week. So another round of applause. Thank you, Jyoti, so much. And thank you to everyone who has been listening. Jyoti, do you have any final comments or anything else you'd like to say before we wrap this up?
Just one comment, I think, for anyone that watches, especially if you're in a healthcare setting, even if you're not, uh, do one thing that or have one positive interaction for today that can make a positive difference in somebody else's day. And that it's that chain reaction of there will
Yeah.
be some positivity coming out of it.
Amazing. Thank you so much. Thank you, everyone, for listening. I'm now going
Thank you
to
for having
close
me.
this fireside chat. Thank you.
Thank you so much.